Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist. I'm making some shorts on what to expect in therapy, and this one is on homework. So, with approaches like counselling and psychotherapy, you often won't be expected to do much between sessions. With approaches like psychology, we will almost always expect you to be doing some between session work, and that can be practicing a particular skill, or it can be completing a worksheet, and the expectation is that you will then be discussing how you got on with that particular task at the start of the following session. For example, with cognitive behaviour therapy, we will often ask clients to complete a thought record, or do a task called behavioural activation or graded exposure, and make a note on a worksheet of how they got on with that. With approaches like dialectical behaviour therapy or EMDR, we might be teaching you particular skills that we're then asking you to practice between session. And we appreciate that a lot of people don't like homework or find it hard to sort of get started with those tasks. We will always do our best to kind of help you to think about, okay, what's the barriers to getting started? Can we kind of help you to work around those? How can you make the task a bit easier or practice a bit more in session first? At the same time, it is really, really important that you do your best to complete those tasks, because if you only ever talk about making changes in session and then go home and do the same thing you've always done, your life isn't going to change. Whereas if you are able to apply the things that we've talked about to your day-to-day life, that's when you'll start noticing differences and improvements. And also with skills, just in general, the more you practice them and the more settings you apply them to and sort of generalize those skills, the more effective they're going to be for you. So please do your best to try and complete the home tasks. And if it's something that you feel like actually that's just not something that I want to commit to, then talk to your therapist, and it might be that actually a different approach like counselling might be more suited to kind of what you're looking for. So I hope that's helped answer a few questions about the homework.